All right, today we're putting on our detective hats. We're going to solve a medical puzzle that affects millions of people out there, polycystic ovary syndrome, or PCOS. We're going to piece together the evidence, clue by clue, and really get to the bottom of how this complex condition gets diagnosed.
Have you ever felt that way? You know, like your body is sending you all these different signals, all these weird symptoms, but you just can't seem to crack the code?
Yeah, it can be super frustrating.
Well, for so many people, these confusing clues, things like irregular periods, weight gain that you can't explain, acne that just won't quit, they all point towards one of the most common hormonal disorders on the planet, PCOS.
So that's exactly what we're going to do in this explainer. We're going to become diagnostic detectives and follow the exact same steps that doctors take to connect the dots and finally solve this medical mystery.
So, where do we even begin an investigation like this? First things first, we've got to understand the nature of the puzzle itself.
And this is probably the most important thing to get right off the bat. There's no single PCOS test. It's not like a pregnancy test where you get a clear yes or no. Nope. A diagnosis is actually built like a jigsaw puzzle, with each piece, blood work, physical exam, and ultrasound, giving us a vital part of the bigger picture.
Okay, so if we know we're solving a puzzle, let's look at how doctors start collecting all those pieces. How do they actually assemble the initial clues?
It all starts with a 4-step investigation. Step 1 is just a conversation, talking about your medical history, your family's history, what symptoms you've been having. Then, a physical exam looks for those external signs. But the real deep dive, that happens next, with blood tests to see what's going on inside, and then an ultrasound to get a direct look. Every single step is designed to rule things out and zero in on what's really happening. All right, now for the really cool, high-tech part of the investigation. Let's crack open the specialist toolkit and take a look at the specific lab work that tells the real hormonal story.
This chart might look a little complicated, but it's pretty straightforward. Doctors are looking at a few key things. First, androgens. Those are hormones like testosterone that are often higher in PCOS. Then, they check your reproductive hormones to see if your cycle is out of whack. Metabolic health is another huge piece because it can show if you're having issues with insulin. And, just as important, they run tests to rule out other conditions like thyroid problems that can mimic PCOS.
And that brings us to one of the main culprits in this whole story, insulin resistance. Think of it this way. Your body cells start to kind of ignore the hormone insulin. So what does your body do? It just produces more insulin to get their attention, basically shouting louder. The big problem is that flood of extra insulin can send a signal to the ovaries to go into overdrive and pump out more of those androgens we just talked about. See how it's all connected?
Okay, so the lab results are in, the numbers are on the page. Now the detective work moves into its next phase, decoding the story. What are these levels and numbers actually telling us?
One of the biggest clues is the relationship between two specific hormones, LH and FSH. Think of them as a team that's supposed to work in perfect harmony, but in PCOS, that team is out of balance. LH is often way high, while FSH is either normal or low. That skewed ratio is a classic textbook indicator that ovulation isn't happening the way it should be. It's a key piece of hormonal evidence.
And the final piece of evidence is often visual, something you can actually see. On an ultrasound, doctors are looking for a very specific pattern, a bunch of small follicles, often described as looking like a string of pearls draped around the ovary. But, and this is a really important note, despite the name polycystic, you can actually have PCOS without having cysts. That's why all the other clues we've gathered are so incredibly important.
But look, a diagnosis isn't just about test results and scans. It takes a really experienced detective, a skilled professional, to interpret all these clues and see the big picture. So let's talk about the expertise that goes into solving this kind of puzzle.
This kind of work is often led by teams with decades of experience. You could have a senior surgeon on the team with over 45 years in the field, bringing an unbelievable amount of knowledge to every single case.
And that kind of expertise doesn't just stay in one clinic. These experienced doctors are often incredible educators, training thousands of the next generation of specialists all around the world.
And that's all complemented by the super specialized skills of gynecological surgeons who've performed thousands upon thousands of advanced procedures. That kind of hands-on experience is just invaluable for getting the diagnosis right.
But you know, it's not just about the numbers and the technical skill. All that clinical expertise is often guided by a philosophy of compassionate, holistic care. Really understanding that wellness goes way beyond a diagnosis. It's about looking at the whole person.
So,
all the clues have been assembled, the puzzle has been solved, and you have a diagnosis. But that is not the end of the story.
So, what happens next?
And this right here is maybe the most important takeaway of all. While there isn't a cure for PCOS in the way we usually think of one, the condition is highly, highly manageable. This isn't a life sentence. It is something that can absolutely be controlled with the right treatment and lifestyle changes.
Which really leaves us with one final thought. Getting that diagnosis can feel like the end of a long, confusing road. But what if it's actually the beginning? The beginning of finally understanding your body, of taking back control, and starting a brand new, manageable path toward a healthy life.